Dr. Varshitha Hemanth, welcome. She'll be presenting on a low-cost alternative to the conventional endoscopic setup in the clinics.
Good evening, everyone. I'll be presenting a low-cost alternative to the conventional endoscopic setup in the clinics. Ophthalmic plastic surgeons are increasingly inclining towards endoscopic dacryology procedures, and endoscopy provides a better insight in assessing the ostium post-DCR. There are many conventional portable OPD-based endoscopy systems available, costing 2 to 3 lakhs and above. This is a major limitation. Necessity is the mother of all invention. Jugaad is a flexible approach to problem solving that uses limited resources in an innovative way. I came across this gadget marketed as a microscope boroscope inspection camera. It is easily available on online shopping platforms, costing between 1,300 Indian rupees to 2,000 rupees. The boroscopes are also called industrial endoscopes, and they are used for visual inspection of aircraft engines, industrial gas turbines, steam turbines, diesel engines, automotive and truck engines. So this is a low-cost alternative to the conventional endoscopic setup. It has a camera end and a USB end. The camera is surrounded by LED lights. The illumination can be adjusted. It can be increased or decreased using this dial. An app which is free is downloaded from the Play Store. The USB end is connected to the phone. It comes in different pins. So whatever images are seen through the camera can be now seen on the phone screen. This is a useful adjunct in the OPD to assess the nasal cavity. So where can this be used? The different scenarios are pre-operative assessment of the nasal cavity before planning a DCR. These are the pictures from the device. In post-operative assessment of the DCR ostium, in managing any stent-related complications, and assessing a failed DCR. For the novice oculoplasty surgeon, examining the nasal cavity it can prove to be very helpful, especially in narrow nasal cavities before planning an endoscopic DCR. The area of interest, that is the middle turbinate, the maxillary line, can be easily seen. Assessment of the DCR ostium at 4 to 6 weeks post-surgery is important to pick up any early signs of DCR failure, like granuloma, and that can be managed accordingly. This can improve the surgical outcomes and the success rate. So in this video, we can see the ostium and the stent. The stent is here removed under direct visualization. So other factors like edge of the ostium, all of them can be examined using this device. The other two important things, the fluorescein endoscopy dye test and the ICO dynamicity, is demonstrated in this video here. So with every blink rate, you can see that the internal common opening is moving. This is also utilized in assessing the failed DCR in the OPD. This helps in surgical planning. I've shown two cases here. There is cicatricial closure of the ostium here, and the indentation on the lacrimal probing can be made out. This helps in preoperative surgical planning as well as patient counseling. This is the second case where the cicatricial membrane is seen, and this is the indentation by the lacrimal probe. I just went a step ahead and I did try using this in syringing and probing. This is the inferior turbinate. This is the medializing the inferior turbinate, and this is the probe once passed under direct visualization. This is the discharge from the sac. So the cost of the gadget is approximately 2,000 rupees in comparison to the conventional endoscopy systems, which cost 2 to 3 lakhs and above. Its additional advantages include the quality of images acquired, which are comparable, and its feasibility in assessing the endoscopic DCR. There are various devices which are available, which have been reported, but the limitation is that they are not available in the Indian market and they are costly. In addition to that, they also require purchasing an endoscope. So this fits in the pocket. It is easy to use. It is easy to document. It is cost effective. It definitely cannot replace in the OR, and it is difficult to visualize a narrow nasal cavity and posterior ostia. So this is a gadget which is a low-cost alternative to the conventional endoscopic setup in assessing the nasal cavity and surgical planning in the OPD. The additional advantages include the ease of carrying and transporting, connectivity to the personal phone or computer, and ease of recording and storing images. Thank you.
Nice presentation.
Thank you, sir.
So 1.5 lakhs and is equal
This
to
device.
2000 rupees. It looks very nice. Are you doing endoscopic DCI regularly?
I do endoscopic DCRs regularly, sir. So this helps me in assessing the nasal cavity preoperatively in the OPD. So when I started off initially, I was a little wary of doing endoscopic DCRs in narrow nasal cavities. So this helped me in screening those and also in assessing the failed DCR cases. The other uses of this is that it can, even for distance, suppose my, the postgraduate or the fellow has done a DCR and they want to discuss an ostium. They are in a separate center. Through, WhatsApp calling or sharing the screen, they can share it. And it is also useful in pediatric children, in pediatric age group, where the children, they will definitely not agree for, parents will not agree for a GA, it's traumatic for the child. So this is very easy, the child is really relaxed. So with this, I've also done a stent removal in a child after an endoscopic DCR.
Cannot be incorporated with endoscopic DCR. Okay.
Sir, this can be used only in the OPD. It's not good enough to be used as a replacement in the OR. But this is a useful adjunct, so that once we pick up early signs of failure in the ostium, then we can take the steps accordingly to improve the success rates.
Right.
That was very innovative. But why not in OR? When you can have a reasonably good quality in OPD, why not in OR? Your assistant surgeon or anybody can visualize when you are doing a surgery.
So the logistics become difficult. So when the patient has walked into your OPD, suppose a patient of failed DCR has walked into the OPD, so I don't have to take the patient to the
No,
OR.
that is okay in OPD, but
So this
in the OR, in a much more comfortable position, no? Patient will be in much
yes,
more
sir. So in the OR, the surgery is planned, yes. But this is for the OPD assessment and the counseling. And also, after the surgery, when you just have to see the ostium, this is useful.
Yeah,
We don't
anyway,
have to take the patient again to the OR.
Okay, I think you can change your mind. You can start using in OR also. Then your utility and will be increased.
Yes, sir. I definitely try. Thank you,
I
sir.
think in the OR, it's very flexible to be used in endoscopic DCR. The thing is very flexible. And I'm also using it for congenital syringing probing cases. One of my ENT doctor colleague, she introduced it to me because she was using it to check ASM and all in the ear.
Wax clearing, yeah.
Yes.
That's what. Picture quality is
So
not that good to just. 2000 rupees.
Yes.
2000.
Anyhow, it is a good tools for explaining what is going on.
It's there.
So maybe our ophthal community is not very well versed with it, but ENT people are commonly using it to check
The
the
ear.
tympanum actually. Yes. Yeah.
Increasing the quality of the camera and all with
So
with
the
the passage of
pictures-
time.
Yes, so the pictures
Yeah.
which I shared here and the videos are
Okay.
from this.
Yeah, that's quite reasonable. Okay, anyhow, thank
you,
you.
sir.
Thank you.